All right, good evening. My name is Tim Gibbs, Director of Delaware Health Force. We are delighted to have you all here in the audience this evening, joining us with our colleagues from Christiana Care. This is the late spring session of Delaware Mini Medical School, and we're glad to have you here. So you can follow us on social media. All of these tags are also on the website. And importantly here, you'll see the website address for Delaware Mini Medical School, or delawareminimed.org. And that's where you can and should go to catch up on any sessions that you missed, PowerPoint presentations, and so on. We are streaming live to YouTube. The channel is youtube.com/Delamed302. And I believe that Christy or Nicole will be additionally dropping the direct link to this live stream into the chat. About the program, for those of you who have been in MiniMed before, welcome back. For those of you who are new, we've been around since 1930. That is the Academy of Medicine. MiniMed's been running continually since 2009. This particular set of series has been funded by state and local fiscal recovery funds, also known as ARPA funding. We do partnerships with a number of organizations for this series. It's with between Delaware Health Force, the Sussex County Health Coalition, and Christiana Care. You can attend as many of the mini medical series throughout the state that you would like. If you attend all 6 sessions live, or if you attend 5 sessions with 1 allowable makeup session, you will get a signed certificate. For other people, you can do a self-signed certificate. Important to note that these are only for educational purposes. Attending medical school and getting a certificate doesn't qualify you to do any kind of a medical job. This is to help you in your advancement on the career ladder, and also, of course, for our adult learners. There is no continuing education credit. In other words, this does not provide CME or CE. There are no grades or tests. However, if you miss a session, there will be a couple of questions that you'll need to answer after you've done the makeup session. So why do we do this? Well, first and foremost, we want to enhance health literacy in our community. We want to expose middle, junior, high school, and undergrad students to a range of topics and types of providers as part of their career goal setting and achievement. Presenters are going to be sharing pathways with students to clarify how they got to where they are today. And also, it's to encourage a dialogue between you, the students, using the Q&A feature, and the instructors in a safe setting, where personal medical issues aren't going to be part of what we're going to talk about. You're not about to get a shot or bad news from your healthcare provider. This is a safe space here. Housekeeping tips. This is a Zoom webinar, not a Zoom meeting. We don't see you. You don't see each other. We all only see the presenters. Please do use the Q&A feature. We don't use the raised hand feature at all. Remember, don't ask questions of a personal or family nature. All questions, excuse me, to the best of our ability will be addressed, some by staff if they're housekeeping related, others by our presenters for this evening. You do need to stay through the entire presentation. However, when it gets to Q&A, you're free to leave. I always say, though, that some of the best information comes out in the Q&A. At this point, I'm going to turn it over to our colleague, Christy Handley with the Sussex County Health Coalition. Christy, over to you.
Great. Thank you, Tim, and welcome to everyone for joining us this evening. A little bit about Sussex County Health Coalition. Sussex County Health Coalition was developed to make sure that we stayed engaged with all of our communities and collaborated with them, as well as some of the health systems and some of the other community-based organizations in the area to make sure that we were improving the health of the children, youth, and families within our communities. We do that by raising community awareness of health issues, and that may be through advocacy, or that's just sharing information, where it's making sure that individuals within our communities have the resources they need to live a successful life. We also give the voice to our community so we can raise their concerns and their ideas. We engage with others from all the communities in community health promotion. We develop and mobilize community resources. We build capacity for policy and program development. We also support other collaborative efforts to make sure that we are improving our community's health and wellness. And we evaluate all that we do, and then we report out for impact to either our funders, to the community, to the state, whomever that might be. We make sure that they understand what the needs and the challenges are within our own communities. So tonight, go ahead, Tim.
So this is the spring session that you all have signed up for. We're going to be starting off tonight with Dr. Salam, Levine, and then with Tamekia Chisholm, who's MSN, a nurse, and then with Liz Masten, who is a physician assistant. And I'm just realizing that I probably grabbed the wrong slide deck, but that's okay. We'll fix that later. We're going to be talking about unlocking your future, careers in healthcare. And then next week, we're going to be covering emergency medicine. The following week, the case of yellowing man. The following week, breaking through barriers, tackling medical complexities locally and globally. The following week, rheumatoid arthritis. And then the final week, the curious case of a toothy ovary. I can't wait for that one. Back to you, Christy.
Great, thanks, Tim. So I'm going to start off with introducing one of our speakers, Tabassum Salam. She is a board-certified internal medicine physician with 20 years of multifaceted experience in healthcare. She's keeping direct patient care as a constant point of reference. She has held various leadership roles in health systems and national physician membership organizations. In her current role as the Chief Learning Officer at Christiana Care, Dr. Salam works with a multi-professional academic affairs team to deliver learning and professional development programs to physicians and other clinicians at all stages of their education. She received her medical degree from the University of Pennsylvania Perelman School of Medicine and her MBA from the Wharton School at the University of Pennsylvania. We also have Brian Levine, who is the Associate Chief Academic Official and Designated Institutional Officer of Christiana Care. He has oversight of the graduate and undergraduate medical education, as well as virtual education and simulation training center, continuing medical education, medical libraries, and the allied health programs. He has an extensive background in graduate medical education, having served as program director of the emergency medicine residency program from 2012 to 2018, and as the associate program director from 2006 to 2012. He's a clinical professor of emergency medicine at Sidney Kimmel Medical College at Thomas Jefferson University in Philadelphia. He received his medical degree from the University of Vermont Larner College of Medicine and is a graduate of the emergency medicine residency program at Christiana Care. He also serves as the associate medical director for the LifeNet Aeromedical Transport Program. Thank you for being here, and we welcome you, and I'm going to turn it over to Dr. Salam.
Good evening, everybody. Thank you so much, Christy, and thank you, Tim, for the welcoming us to this program and this series. Christiana Care is really excited to be able to bring you a series of wonderful speakers and all those wonderful topics, including the case of the toothy ovary that will be our finale. We're kicking off strong, though. We wanted to be able to bring the audience today the opportunity to learn about the pathways to careers in healthcare. There are a ton of different professions that professional roles that have to come together in a team-based manner to provide care to patients today. And we decided today to highlight 3 of those professional areas of practice: nursing, physician's assistants, and physicians or doctors. So in no particular order, but we chose this one. We're going to start with nursing, move into the physician's assistant role and pathway to that career, and end with that the pathway of a physician. I'm very excited to welcome our colleague in the world of education at Christiana Care, Tamekia Chisholm, MSN. She is a nursing professional development director who works with us, with Dr. Levine and myself. She's worked for Christiana Care for almost 29 years. She earned her bachelor's degree from Rutgers in 1993 and her master's in the science of nursing from the University of Delaware in 2009. She has multiple certifications, and she'll tell you about the importance of those as you advance in a career as a nurse. Hers are as an adult health clinical nurse specialist. She's also certified in progressive care and in nursing professional development. We are going to follow up with a presentation from Liz Masten, another one of our education colleagues. She is a certified physician's assistant. She is our director for PA students and allied health education at Christiana Care. She herself has practiced as a physician's assistant for almost 18 years. Her areas of expertise are emergency medicine and trauma. She has been also an academic for over 12 years, and we're very excited to have her on our team. I'm going to turn things over to Tamekia to kick things off. She's going to tell us all about the world of nursing as a career, but also going to give you a deep dive into all the education that it takes to enjoy that career path. Tamekia, please take it away.
Thank you, Dr. Salam. Hello, everyone. Good evening. I'm going to talk to you about being a registered nurse, something that I'm very proud of and enjoy talking about and encouraging others to become a nurse. I have, as Dr. Salam mentioned, I've been a nurse for actually close to 31 years, and I've worked at Christiana Care for 29 of those 31 years. So I have a lot of nursing under my belt. So just to recap a little, a registered nurse is a healthcare professional that is licensed by the state, that has also completed a education program and has been licensed. So in preparation for to become a registered nurse, of course, you have to have your high school diploma, and it's science-based. So you really want to make sure that the biology and chemistry, you have that underneath your belt, because you're going to build your education more in the sciences. Now, to become a nurse, there are various programs that are associated, associate's degree in nursing, which is considered an ADN. It's usually about 2 to 3 years, and that would be like a clinical school, a local school. Then you also have the bachelor's in science, which is the preferred degree. However, you can start your nursing degree with an associate's and then advance to a bachelor's degree. And that typically is about 4 years. Once you become a nurse, after you've completed, you can advance your degree. Just like Dr. Salam mentioned, I have my master's degree in nursing, and you can also advance even further and become a doctorate in nursing practice or receive your PhD. Ultimately, whenever you complete your degree program, you must be licensed by the state. There is a test, a rigorous test that you do have to complete, and once you've completed that test and pass it, then you can become licensed by the state. So next slide. So with your clinical training to become a nurse, the schooling is going to prepare you to be able to care for all ages. Also all ages and also different settings. So your clinical rotations will help you prepare to be able to care for different types of patients in the hospital setting, various outpatient clinics, also community health centers, and various different places. So while you are preparing, you are getting exposure to different types, different places where nurses actually work. There's also multiple specialties that your schooling will prepare you for, such as pediatrics, adult health, emergency care, surgical, cardiac, critical care. So you want to explore different specialties in nursing and find what you're passionate. Also, exposure can come in the form of internships or externships to give you different additional practical experience and to help you build up your skills as a nurse. Okay, next slide. All right, so career opportunities for registered nurses. Of course, hospital settings such as Christiana Care, you can be a staff nurse. A staff nurse would care for patients directly at the bedside. A charge nurse is part of the chain of command. It's kind of like the supervisor to help manage the an additional leadership possibility at the local level at the bedside. Nurse manager or a nurse educator. So the majority of my nursing career, I have worked as a nurse educator. I started out as a direct care unit-based educator, and then I became a system-wide educator, and then advanced to manager and now director. There are other settings such as community health, public health nursing, school nursing, home health for caring for people in their home, long-term care facilities, and also in other variations of research and academia. There's also advanced practice nursing roles. I am also considered an advanced practice nurse. I am a clinical nurse specialist, which is with advanced nursing, you have your nurse practitioners, you have your nurse anesthetists that help to during surgery, nurse midwives delivering babies, and as well as caring for mothers while they're pregnant. And then as a clinical nurse specialist, having a direct care for an advanced care for as a resource for caring for patients. Next slide. All right, so lifelong learning and growth. So once you become a nurse, it never stops. It's always looking for different ways to increase your professional development, whether it's obtaining a certification, specialty certification, such as critical care, education, oncology. So just like I mentioned before, I have multiple certifications, and it's all about your passion and things that you are interested in. It's actually a badge of honor to obtain a certification. I have certification in progressive care, which is caring for like step down patients or patients that are not necessarily to the point of critical care, but also still need an advanced care. I'm also certified as an educator in my nursing professional development certification. I also am certified as a clinical nurse specialist in adult health. And I have one more certification that I plan to obtain is my leadership certification. Advanced degrees, once again, following your passion and where your desire, what type of patient you want to care for. So you may want to pursue a master's degree or a doctorate in nursing practice or PhD if research is something you're interested in. Another way to advance your career as well as increase your knowledge is to join a professional organization. Many professional organizations are associated with specialties and as well as the type of nursing that you are involved in. So maybe like the Advanced American Nurses Association, or something local such as the Delaware Nurses Association or the um, Delaware Organization of Nurse Leaders. Those are a few of the professional organizations that I also belong to. And lifelong learning continues with workshops, webinars, conferences, things that will increase your knowledge as well as help to fill you up, to fill your own professional development and give you things that will help you to advance in your career. And I think that is, oh, one more thing, one more slide. Challenges and rewards of nursing. Of course, there is, with nursing, is a very high stress levels. You want to help and you want to care for people. So it's about managing many of the different areas that you're going to be caring for, as well as to try to promote wellness as well as wellness within yourself. The workforce, there's a shortage of nurses, so a lot of turnover. One thing that I can say is very rewarding with nursing is that you follow your passion and you can change, you can switch up, you can explore different options in nursing. You know, maybe care for adults and then maybe care for children, pediatrics, or delivering babies. You go where your passion is. And that may mean whatever is going to help you to satisfy your own personal fulfillment or where you feel that you're making a difference. And there's so many different opportunities within nursing. It is definitely a fulfilling career in which you get a lot of reward from caring, helping, educating, as well as being a great resource. Because once you are a nurse, you are a great resource for, especially for your family and friends.
Thanks so much, Tamekia. I want the audience to keep a few things in mind as you listen to the next two sets of presentations. You'll see a common theme, regardless of the actual profession that you're seeking to develop into. Because if you're in the world of healthcare, there are some common threads. You're going to encounter science. It's pretty obvious, but I wanted to reinforce that. Tamekia mentioned that very clearly. As early as high school, you're going to want to be taking chemistry and biology as a foundation on which you're going to build your education as you advance. All of the roles we're discussing today, in the course of your education, there's hands-on learning. There's classroom learning as well as hands-on learning. And I think it's really important to emphasize there's lifelong learning in all professions in the world of healthcare. Tamekia was very clearly helped you understand the various stages or versions of that for someone who trains as a nurse. Keep listening with your ears perked for similar lifelong learning opportunities for those who choose to become physician's assistants or physicians. I'm going to turn things over to our other colleague, Liz Masten, and she's going to reveal more about the mysteries of how to become a physician's assistant. Liz, please.
Thank you, Dr. Salam. I'm really excited to be here and kind of talk about the journey of being a PA. It's been a fantastic profession for myself, and I've learned from so many colleagues, from my nursing colleagues, from my physician colleagues throughout my entire career. So it's been a great trajectory for me. So I'm excited to kind of share a little bit about the pathway and kind of your journey to basically how to become a PA. All right, so I get a lot of questions a lot of times from patients. What exactly does a physician assistant do? So basically, I always kind of break it down. So what can we do? We can take a medical history and do a physical exam on a patient, anything from head to toe. We can do routine physical exams, diagnose illnesses, and again, this is across the entire lifespan. I've seen everything from newborns all the way up to mums and pop-ups that are well over 100 years old. So that's the nice thing that you get to see the full gambit of the age spectrum. We can certainly order tests, things like blood work, x-rays, CAT scans, MRIs to help us diagnose or narrow it down if we're unsure of a diagnosis. We can prescribe medications. A lot of times people are very curious if we can refill their blood pressure medicine or prescribe an antibiotic, and we definitely can. We can give vaccines as well. We can perform procedures. A lot of times, a lot of the focus during my training was a lot of hands-on suturing. I learned how to intubate, how to do take care of abscesses, right? So pockets of infection that occur throughout the body, and learning how to incise and drain them. As well as we can assist surgeons in an operating room. We can close, we can open, surgical wounds within the OR. So it's pretty cool, the hands-on that we can do. And again, we can see patients across the entire lifespan. So when you are thinking about becoming a PA, again, it requires an undergraduate degree. Definitely preferred more in a health science field. Most applicants will have a science degree in either psychology, medical technology. We see a lot of kinesiology, bio, micro, chem. And what you will see is that a lot of them have basically hit the very heavy science courses, things like organic chemistry, bioorganic chemistry, microbiology, all the big science courses you definitely want to make sure that you take. A lot of times that you will see that most undergrads, you definitely want to, for your science courses, get a minimum of a 3.0 GPA. Each PA program requires certain undergraduate degrees in different classes, anatomy and physiology with a lab. A lot of them like to see the dreaded organic chemistry 1 and 2 in there as well. So if you're thinking about becoming a PA, kind of have a general idea of maybe where you would like to apply, it's always a good idea to kind of take a look at each of the PA programs and the different requirements that they want in preparation and mapping out your courses in an undergrad to make sure that you have everything completed by the time you graduate. A lot of PA programs, it is extremely competitive these days. You'll see that an overall GPA for PA applicants is usually around a 3.6, give or take. Each program is definitely different. But science GPA for sure, you want to make sure that you're really buckling down on those science undergrad courses, as that becomes the foundation from all the knowledge that you will acquire from that point on. So you will see general GPA is usually around a 3.5. Every PA school requires patient contact or patient care hours. And what they like to see is that you are getting some hands-on experience in dealing with patients, right? A lot of PA programs will ask for patient contact hours, anywhere from 200 to 4,000 hours is usually. On average, most students do about 1,000 hours. And these can be through paid or volunteer opportunities. Many PA students that I've seen have, done a variety of different experiences to get their patient contact hours. A lot of them will go through a volunteer EMT program and become an EMT right along, and the ambulances respond to, urgent cases for patients. A lot of them become CNAs, medical scribes, phlebotomy I've seen, LPNs, and medical assistants. It's good to kind of get, a basis of understanding medicine and the flow of medicine. So once you decide, Hey, PA is for me. All PA students or all, pre-matriculate PA students, you'll have to apply through something called CASPA, which is the centralized application service for physician assistants. It is a central application that gets sent to any PA program that you wish to apply to. It is long, it is painful, but basically you're uploading all of your patient care hours that you've experienced, all of your grades and all of your courses, letters of recommendation, all of that, pretty much everything about you that's important will get uploaded into the centralized application called your CASPA. I strongly encourage those that are interested to make sure that you're getting some PA shadowing hours. Spend a day or two with a PA, kind of live their life for a day, get a feel of what it means to be a PA in medicine. It's definitely strongly encouraged by most PA programs that you have that sort of experience. And ideally, a letter of recommendation always looks good too. So if you spend a considerable amount of time with the PA, you feel like they can speak to you or about you, then that's always ideal as well. Once you complete your application, you get, accepted into a PA program. Yay, always exciting. You'll understand that all PA programs end with a master's degree. That is our terminal degree. Most programs are on average about 24 to 27 months. There are some part-time programs and they're go about 36 months, which is great. You will have your didactic and clinical year. So what does that mean? So you'll have your didactic year first. So that is all of your lectures, your labs. This is where you start to learn how to do a physical exam. You start to learn how to suture, how to take a history from a patient. So that's all complete in your didactic year. And then once you complete that successfully, you'll move on to your clinical year. And that's the fun stuff. That's where you take everything that you learned in your first year and you start to apply it into the clinical realm. That's where you'll start to diagnose, treat real patients under the supervision of a medical provider. So most PA programs, most clinical years are about a year to a year and a half. So once you complete your PA program and you graduate from your accredited PA school, you'll go on to take your board exam. The board exam is what allows you to practice medicine. You'll do this through the NCCPA. They oversee all of our board certifications as a PA. It's a 300-question exam. You take it at a testing center, and you must recert every 10 years. So as a PA, we take our entrance exams called your PANCE exam, the PANCE, not the ones you wear. And then every 10 years, you'll take your PANRE, which is your recertification exam. And then every 2 years, we do 100 continuing medical education credits. So like Tamekia said, being a lifelong learner, yes, you definitely will be a lifelong learner. Why? Because medicine is rapidly changing, as we know. Medications get updated, procedures, all of that is really, really important that you stay current. So the idea of doing all those continuing medical education credits is really important. And then beyond certification. So once you pass your boards, you can go out there, you can treat patients in whatever fields that you're most interested in. There's always the option of doing a fellowship. There are more and more PA fellowships that are popping up throughout the country. And what fellowships are usually roughly about a year or so training program after you graduate. And what it does in particularly specialized fields like neonatology, emergency medicine, critical care, you get an extra year of training. You still work at the PA, you still earn a paycheck. A lot of people like to know that, but it allows you a lot more time to become more familiar, more specialized in the field that you've chosen. Not necessary, but definitely beneficial to do fellowships once you graduate and pass boards. And then some PAs go on to get a doctorate degree. At this present time, it is not necessary to get a doctorate degree in order to practice as a PA. A lot of PAs do it because they end up in academia, become a professor. So you'll see that. but not necessary right at this point in practicing to be a PA. So, and there's various doctorate degrees available. So.
All right. That was wonderful, Liz and Tamika. And I will let Tabassum kick this off and then I'll probably run from here. But I love, Tabassum, how you brought up the themes. So similar. And you'll see similar themes with us as well. So I can let you want to create the pathway for me and then I'll run with it.
Sounds great. So, yeah, the themes are identical, very similar throughout the three different pathways we're highlighting today. So, science-based curriculum, hands-on experience built into your learning, stages of advanced education. You will be learning um, till the day you retire, and even beyond if you choose to. The other thing that both my colleagues have already brought up is licensure. That is a little bit different than the classroom learning and the degree you're earning. You get that from the university you attend. In addition, you will have to take a separate set of exams to become a nurse, for example, to become a PA, to get your license from the state or multiple states where you want to practice. Dr. Levine and I both also have licenses to practice as physicians, and Liz has hers as a physician assistant. Tamekia has that as a nurse. You often hear the word registered nurse. That is a title given to those who obtain that licensure. So keep those themes in mind. Brian, let me turn it back over to you. Talk us through parallels in becoming a doctor.
Perfect. So what we're going to really talk about is trying to understand our profession, the medical profession, the pathway through education, what medical school is like and the training, the skills and qualities to be a successful physician, and then the challenges and rewards. So it's very similar to what Tamika and Liz were talking about. So understanding the medical profession. So what does a doctor do? And it also parallels what you just heard. Diagnosis and treatment. Our role is to assess patients to try and determine what their underlying illness is, determine appropriate treatment plans for recovery. So that's sort of depending on what physician you are. Like myself, emergency medicine, I see most people who are just sick. And sick, I can mean stroke, heart attack, the flu, but I also see non-sick people, people with psychiatric illnesses or pregnant patients are not sick. They're here for other reasons outside acute illnesses. So there's such a variety in emergency medicine, but there's a variety in all medicine because every human is different. And that's what makes our job so exciting. We can also do preventive care where you maintain the health of your patients. And that's important from a regular checkup standpoint, checking blood work, vaccinations, screening for cancers, etc. And preventive care has been shown to extend life and in a much more healthy and satisfying way by avoiding medications and a variety of other expensive treatment. So preventive care is important. And then thirdly, what I always say to my students is you have to love to teach. We are teachers at heart. Our patients are our students, and we get to educate them about their health and lifestyle choices, etc. So that's exciting. And the fourth part for me, and Tabassum could agree, is teaching in general. I love teaching students. I love teaching our residents and fellows, and as I'm sure Tamekia and Liz agree, that keeps me in the swing of things, keeps me young, keeps me educated, keeps me up to date. And that really is an important fourth factor. Tabassum, agree?
I totally agree. That's our passion. I love that I get to indulge in both of them in my everyday career, which is practicing and teaching, and joining the two together is lovely. I want to emphasize what Brian was just saying. There are many different settings and different styles of practice. I love that Brian practices emergency medicine, a more fast-paced sort of episode of care type of interactions with patients. He sees them when they're in crisis and they need him, and he helps them out. I, on the other hand, practice in a more what we call longitudinal way. I practice primary care, where I get to see patients repeatedly over time. So, for those of you who in our audience who are younger and see your pediatrician at least once a year, maybe several times a year, I do the same sort of thing for adults. I have checkups with them. If they have any long-standing conditions that need treatment, like high blood pressure or diabetes, I get to see my patients again and again over time. And it's the style of practice that I've chosen. My colleagues Liz and Tamekia, as you heard, when they train up as a physician assistant, as a nurse, you can choose the type of setting you practice in. And there's some flexibility in the world of physician assistant and nursing to shift around. Brian and I can talk about why the shift is a little less easy to do as a physician, because he's going to tell you in just a second about residency and fellowship training that allows us to hone in and specialize.
And you bring up a great point about the different types of physicians and specialization. There are over 100 specialties. It's fascinating. And even subsets. So in emergency medicine, there are 8 subspecialties. In surgery, there are a couple of dozen. So if you want to become a certain type of surgeon, generally you'll have different types of training. And it really is about what your passion lies and where you stand. Because family medicine doctors could see patients from newborns all the way to grandma, whereas internal medicine generally starts at 18 and goes to the elderly. So there is variation on all of these, which is kind of cool. You get to pick and choose what you like, and that what makes it different. I mean, delivering babies, people, you can, do that for a career, or you can just do women's health without delivering babies. So there's variations on everything depending on where your passion lies, and I think that really makes it, fascinating and very cool. And we do, and hopefully society appreciates us, but we do have a really big, large impact on society, from really just like the acute care, treating illnesses and the well-being of individuals, obviously. But we get involved with public health and the government and initiatives that improving outcomes. That's really what it's all about. I always tell my students that if you put the patient's interest first, you'll never be wrong, ever. And that's the most important thing. And that's what I think about every time I enter a room. It's really important. We also do some great research. I'll tell you, I'm a clinical person where I mostly was all about seeing patients. But since I worked in a teaching hospital, especially one that had training programs like you're going to hear about in a minute, it allowed me to dabble in research. So I've written a couple of chapters in books. I've written some books, and I've written some medical articles, which are really fun to do. And I'm just not a major researcher where I do that full time, but I think it's important to stay up on the research. So by entering and doing research, it keeps you in tune with the latest and greatest in the new technologies and the new theories and the new medications. And I think that's also keeps you young. And then there's just large community relationships that I think are really important. And us as clinicians, Tamekia, Liz, Dr. Salam and I really are all about aligning with the community and doing what's right for the community. Because if you don't keep them healthy, we're failing in our roles as clinicians.
It's important to also note we we train together in all as we work into all of these different professions, and we practice together. Many of the clinical sites and types of care that Dr. Levine just described are not solely, the care is not solely provided by a doctor. It's provided by a team. You can have physician's assistants working right alongside a physician and a nurse, and many other disciplines as well. You'll see if you've ever been a patient, you probably didn't just meet one clinical expert during your visit to an office or a hospital or an emergency department or an urgent care center. You met at least 2 or 3. We all have different parts to play in a very complex setting. Each of us has an expertise and contributes to a patient's care. And that's really the fun part. There's a lot of work to go around, there's a lot of camaraderie to build with your colleagues. We train in slightly different ways, but we all practice together.
That
Back
is
to you,
so
Dr.
true.
Levine. Yeah.
And that's what we always say, especially in emergency medicine, but everywhere. It's a team, and the team becomes your family. I really treat the people I work with like my family. You spend more time with your team sometimes than you do your own family anyway. So you hopefully get along with them. But I love the people I work with, and I think that's really important. As was alluded to by Dr. Salam, the educational pathway is a little different, but it still follows a very similar pattern, especially the foundational information in high school, where a lot of you guys are now. The important is to do the best you can. Obviously, you want to excel in science and math. You don't have to be 4.0, but you really should do the best you can to try and prepare yourself for college, where the grades really count, as you've heard from Tamekia and Liz. Extracurricular activities are great. You're not here just to purely study 12 hours a day and go to bed. That's you have a life, and we really want you to live it. And part of that is caring for your family and friends. I think that's really important. It keeps you grounded and prevents burnout. But doing extracurricular things now is really important. One, it builds up your CV, but it keeps you healthy if you're playing sports. It keeps you your mind working if you're doing certain scholarly things after school. There's a whole variety of activities you could do. We push or really recommend highly volunteering or get patient-facing experiences. And I think volunteering and shadowing are the greatest opportunities for you to see how a hospital works. I volunteered and I shadowed, and I will tell you, 99% of the medical students, I'm sure Liz and Tamekia will say the same thing, have done some element of volunteering or shadowing, because we want you to know what this life is like or what this experience is like, because you may find the sight of blood makes you sick, or you don't want to see the dealing with sick patients may bother you emotionally, and it may be too much. So we want to make sure you're going into the right career. So by doing these activities prior to, really committing towards a healthcare career will open your eyes and set the stage for you and your future.
I also want to emphasize you should volunteer in a variety of different settings. Healthcare is, of course, wonderful, but volunteer in your communities. Volunteer at the food bank, for example. Find ways to experience the joy of giving back, serving others, serving through other communities, through other organizations. All of that's going to matter and help you really cement your love for a lifetime of service.
I love that. My job is really all about community and their wellness and health. And, volunteering or working for those kind of organizations, aid organizations, nursing homes, anything that where you can have an impact on your community. But you know what the colleges and medical schools love? When you do it longitudinally. You don't do it one weekend a year during Thanksgiving because you want to show that you're giving back for 3 hours. We love when you do it several times a month or for 6 months or a year. That shows dedication, it shows passion, and it shows you're committed. So I think I see that on applications where someone did 3 days here, 3 days there. Maybe you want to, evaluate and check things out, but we like you to be committed in something, especially if you find it's something that you're passionate about. When you look at undergraduate stuff, which is college, you have to obviously have a bachelor's degree to even apply to medical school, which is totally fine. And most, if not all, colleges will have some sort of mentoring or pre-medical program that will give you the information that you need to get an appropriate application, so it'll get reviewed at the medical school of your choice. So for us, and I believe we're going to get into, we'll talk about it a little bit, but it's really sciences are required, and it's 2 years of biology, 2 years of chemistry, which is a year of inorganic and a year of organic, and then physics. And a lot of other medical schools really highly recommend statistics and other things. So it is a little bit science heavy, but that's important because the MCAT, or the entrance exam, is heavy on that as well. So we want you to do the best you can in college in your science courses, and that's really important. And your college should have some mentorship as well. There are also research opportunities. If you're in college and you get an opportunity to do research, that really boosts your application, yet it's not required. If you're going to do research, we want you to enjoy it. If it didn't work for you, you can, generally stop, and it won't hurt your application. But if you're interested and you really want to boost your application and be a little bit more competitive, it would be a year or two in research, where even you get to present at a meeting or a conference. And even after that, publish or write a paper with your professors and or those you're working with. That really looks great, but it's not required. I will tell you, when I applied to medical school, research was like you had to do it. That, you know, is a really important part of the application. But these days, and Dr. Salam and I sit on admissions committees, we've seen a less emphasis on heavy duty research, but just that you're doing something longitudinally or something educational as well. Now, like we mentioned, it is very competitive, and I do not want to scare you off, and either probably did Tamekia or Liz, because nursing school, PA school, and medical school are all very, very competitive. There are some medical schools that have over 1,000 applications for a class of 250. So it's a challenge, no doubt about it, but it's not impossible because I got in, and I'm not the smartest guy in the world. So you need a competitive GPA, and for most medical schools, that generally is in the 3.8 range. And you could Google average medical school GPAs and they'll tell you what they offer each medical school, but it's generally in the 3.8 range. But there are people with 3.6s that can get in as well, as long as they have other components of their application that has some really strong features to it. The second biggest and most important thing is the MCAT scores. It's the Medical College Admissions Test. You really want to be at least at the national average. And I don't want to throw around numbers. You can look them up online, and it's too early for you to worry about that much. But that's an exam that is 8 hours that you study for 3 to 6 months for. And that was a tough one for me. I'm not a great test taker. I did just above the national average, but I studied 3 hours a night for about 3 months. And that was really, really hard. And you walk out of that test really lightheaded because there's so much thinking and your brain uses so much glucose. So, but that MCAT is really critical. For you to take seriously. And I will say, if there are any college students on the line, now is your time to befriend a professor or get, in a relationship where that somebody you're working with or understands your passion can write a letter of recommendation in a positive fashion that could be admitted or put into your application materials. And it's generally 3 letters are required for the average medical school. So if you've did research with someone, if you've done EMS, if you've done volunteering, get great letters from those. You should start thinking about looking, for individuals to write you those letters, because I think that's really important. And they want to see that you've had some healthcare experience, something patient forward. It doesn't have to be all that way, as Dr. Salam mentioned, but they want to show that you're committed and you have a passion for healthcare. Dr. Salam, what did I miss?
You hit the highlights. You definitely want to convey your passion for this career. You will be writing a personal statement, for example, in your application. That's the place for you to tell us about you and why you want to do this, and anything unique or special about yourself. It is a little bit about the grades, but it's much more about you, the well-rounded person.
Couldn't agree more. Now, this will be a little bit more brief because this is now getting into the medical school curriculum or what happens when you're in medical school. And most medical schools in general, it's a year and a half to 2 years of pure classroom-based, what Liz called as didactics, which is really classroom, laboratories, cadaver labs, etc. But during those first 2 years, you're still learning how to do a standard history and physical and how you're going to see patients. You just don't see them on a regular basis. So that's your first half of medical school. Your second half is generally 2 to 2.5 years of clinical rotation, which means you're going to rotate in what we call the big six: surgery, psychiatry, pediatrics, internal medicine, family medicine, OBGYN. So that's what you're going to spend 2 to 3 months on each of those 6 specialties during your third year, just so you have an opportunity to see the broad breadth of foundational general hospital medicine. But it also includes some office experiences as well. And I think that's really important. And then by the end of your third year, you start thinking about what you really want to do with your career and what's next. And by that, you'll sort of, you're looking at what you did in your third year, which was hands-on experience where you're actually taking care of patients and almost taking ownership. When I was a medical student, they would say, okay, Brian, we know you're only a third-year medical student, but you're going to have 2 patients today that are going to be yours, and you have to know everything about them, their lab work, their issues, and what the plans are for their care. And that's how you learn to become independent, which is kind of cool. And with having those big six, you get to see the various specialties and get exposure throughout different areas of the hospital, and to try and help you towards figuring out what you wanted to do for a career, which is kind of interesting because for me, and I'll let Dr. Salam answer on her, it took me 3 years to figure out what I wanted to do because I thought I was orthopedics all the way. And then I kept finding myself peering into every specialty as they saw patients in the emergency department in either on internal medicine or family medicine or surgery. When they would say, go to the emergency department to go see a patient, I would be like so excited because I wanted to see the undifferentiated patient, the patient who they didn't know what was wrong with them, and see if I can figure it out when no one else could, or I can get involved in procedures. That to me was exciting. And I always thought of emergency medicine as the most exciting 10 minutes of every single specialty. I get to do really incredible, fun stuff, and then I get to resuscitate them or make sure they're okay, and then I'll hand them off for longitudinal care, which I think is different than most other specialties. What about you, Dr. Salam? Your journey into learning medicine was for you.
I loved the opportunity to do these clinical rotations for as a third year student, because each successive one, you learned different things. There were different types of patients and different types of care given to those patients. I love seeing the unique aspects, the different age ranges, the different disease types or conditions that were primarily cared for in those specialties. And it was good to do the circuit and see not only the big six, but also some other subspecialties. It allows every medical student to realize which specialties they want to consider for their own career path, as well as maybe the ones that just don't excite them. That's okay too. That's the way that you get to pick and choose your next stage of development and career development. I was very drawn to internal medicine because I like puzzles. I like the challenge of making a diagnosis, of talking to a patient, examining them, looking at their x-rays and CAT scans and all their blood test results, putting it all together and coming up with the most likely diagnosis, and then choosing the treatment plan. I like to think things through a little bit, which is why I know you do a ton of diagnosis in the emergency department too, Dr. Levine. I didn't want to be that rushed in jumping to make a diagnosis because of critical life threatening situations. So for me, internal medicine was just the right fit. And I can practice as an outpatient doctor and as a hospital based doctor, whichever I prefer.
Love it. And then after you get through your middle of, the beginning of your fourth year of medical school, there really is a process for you to apply for specialized training. Because if once you graduate medical school, you can have your MD or DO degree, but you really can't practice until you at least do 1 year of some specialized training. And it may be a generalized specialized training, which sounds complicated, but most people don't do just 1 year. They'll do 3 to 7 years of training called residencies. And that's really the process after medical school when you're training to do your specific specialties. So that's really kind of the long part. And it's a lot of hours, a lot of work. You bust your butt, but you love it. And that to me was residency, to be honest with you. There are skills that you will need to understand as a physician, but also as a PA and an NP or an RN as well. Science skills, we mentioned, very important to understand the concepts. Critical thinking, so you can really sort of understand a lot of different complex variables coming at you and make a really informed, educated decision that's in the best interest of the patient. And you have to be able to problem solve. And Dr. Salam is a better problem solver than I, so that's what medicine is about. I'm much more of a throw things on my face and see how I handle it kind of person. And it's just everyone has their own sort of skill set, to be honest with you. But like I mentioned before, it's not 12 hours a day, all day doing that to get yourself to where you want to be. Your families need you. You need your families. It's great to have friends. You need some sort of social network. You need to enjoy what you're doing. You need to know how to manage your stress. I would definitely, several times during my med school career, called my parents and said, I don't know if I'm cut out for this. And they would talk me off the ledge and say, think about why you're doing this. Think about how much great care you can provide to patients. And it always grounded me. So think now that you're just starting to think about medicine, think of that feeling of what's drawing you towards it right now and never forget that. But there's going to be some definite stressful times during high school, even college, medical school, and residency. So that's important. So self-care is important. For me, I play drums in a band. It gets, it gets all my stress out and it's kind of fun. I did play as a sport in college and I played tons of sports in high school. That to me was getting away from the world a little bit and allowing yourself to de-stress. Some people it's running, treadmills, whatever. But I think all those three, the balance, the stress, and the self-care are critical.
I like to bake.
And this is the reason we do it. I mean, I say every day to Dr. Salam that I'm coming to the hospital. I'm not going to work. I'm not unhappy with where I am. I love what I do, and that's really the rewards. So of what we're doing every day. And I will tell you, I'm so glad I chose what I did. You will not be a millionaire as in any of these three positions. You should never do it for the money. You may have to borrow some money. I borrowed a lot during this, but that should not dissuade you because you'll make plenty of money to be comfortable, but it's not about the money. I was very afraid that I couldn't do medical school because my parents were paying for three kids in college and or graduate school, and they said we can't afford your medical school. So I borrowed the whole way through and I paid it off over time. And it didn't, you know, you have to understand that by going to college and future other schools, whether it's nursing school, PA school, or medical school, you're going to forego some fun things, some family things. That's a sacrifice you're going to take. That's the challenge. But the rewards, for myself, and I'm sure for everyone else on the screen, way outweigh the challenges. And those challenges are there. Like I mentioned, we're not going to sugarcoat it. It's a lot of work. It is stressful and it's competitive. And a lot of people say all these programs, nursing, PA, and medical programs are that competitive from the beginning because they weed out people that just are not completely passionate or that is not completely driven towards to that goal. And I will be honest also, some people just can't do it. And that's okay. If someone says, if you're struggling and yet wind up with a 3.0 and you just can't get, better than that, or you do terribly on standardized exams, maybe it isn't for you, but there are definitely other occupations in allied health or other healthcare arenas that are incredibly rewarding and equally as fun and exciting as what the four of us do. And what was mentioned earlier, you can really make a difference in someone's life. And everyone says, you're in emergency medicine, you save lives. I don't really save lives. I make their lives better. That's really what it's about. Nothing makes me happier when a patient says, can you be my doctor? Or that was the best emergency care I've ever gotten. Those are the ultimate compliments I get. And I love that. And it all comes from, I'm not the smartest guy in the world, but I will be nicer than most people. I'll read more than most people. And I'll go in when I see a patient and be prepared to take the best care of them as if they were my mother, father, sister, or brother. And if I treat everybody like that, you'll never be wrong. But as was mentioned before, continuous learning, I still read just about every day from a journal and or learn from my colleagues. And I like being respected, but I'm not doing it for the respect. I'm doing it because I get complete joy out of really trying to improve somebody's life in a short 15 minutes time period. And that's just my ADD and shortest pension span. It's not like everybody. And each one of the four of us have our own sort of niche of why we did it and what keeps us there and what keeps us excited. So I do open it up to the three of you too, if you want to add anything to that. Great.
Everything you said.
I
We're
just
almost
want to say ditto. Everything you said, it resonates with me. I'm just sitting there like, yeah,
Yep.
uh-huh,
Isn't that
yes.
funny? And it doesn't matter what letters are after your name. We all did it for the same reason. And I'll say I'm selfish. I'm selfish because I want to be happy and I want to make other people happy. And this job is perfect for that. Now, like was mentioned before, you can do a ton of stuff. there's a huge demand for all of these healthcare jobs, including other stuff, allied health, which includes respiratory therapy, occupational therapy, ultrasonography. It's so many cool things that you can get involved with in healthcare, and it's fun, and you can do really well. That's the fulfillment in medicine. So as you mentioned, the challenges are definitely there. It was mentioned by everyone on any of these journeys. It's a lifelong learning experience. You need to acquire and maintain some really cool skills, but it is the ultimate job, and I don't even really call it a job. And people say, "Oh, it's a calling." Maybe, but it's just something I love doing every day. And I think you see it on the faces of everybody else on this panel. We're all in the same exact position and still doing it to this day. And I've been doing it for over 20 years, and I think that's very cool. Any other comments from my panel? Because we're going to do questions. Oh, I see Tim gone already. Shall I stop sharing, Tim?
Sure. All righty. That was fantastic. Thank you so much. Well, we have a lot of questions.
Great.
14 questions right now, and they tend to grow as quickly as we answer them. Okay. In no particular order. Can you move into different departments to get different perspectives of the other specialties? This is from Lori. What I'm not quite sure, this was a question fairly early on.
Yes, I believe it came up when Tamekia was talking. So I think it's involving nursing.
Love it.
Thank you. Tamekia, over to you.
Well, the good thing with nursing is, of course, anytime you transition to another specialty area, there's always some training that you may need. So with nursing, there's always the basic process of nursing, and learning those skills and learning the things to help you succeed in those areas. Like, for example, for myself, I initially, when I was in nursing school, I wanted to deliver babies. And I'm maternal child. That's where I wanted to be. And I was there for 6 months and I hated it. I'm like, no, I don't want to deliver babies. No, thank you. And I transitioned to med surg, which was general nursing, care, a variety of patients, specialties, all within medical and surgical. But where I found my passion was actually in cardiac. I never thought that that would be something that I would be interested in, but I loved everything about the heart, how it ran, how it pumped, how it delivered blood throughout the body, diagnosing issues and problems. I fell in love with the heart. But with anytime you move to a specialty, you have to learn all that you need to know about that specialty. What's necessary for you to deliver care within that area, what type of medications, what type of treatments. So it's anytime you transition to an area, it's just getting that learning and ongoing education to make sure that you can be successful in that area and that specialty.
All righty. Next question, and this has been asked in a couple of different ways. I'm going to ask it in yet a third way. So for Liz, talk to us about the scope of practice for a PA and your ability to practice independently,
Sure.
as opposed to under the supervision of a physician. I know that that's a complex topic.
It is, yes. It's a great question, and it's a question I get asked a lot too as well. It honestly, the scope really depends on the state with which you practice. They all utilize PAs, and the laws are different in each state. In Delaware, working in an ER or just as a PA, your license is tied to a physician. You have a supervising physician that has to be but a phone call away. If you have questions, concerns, but I have plenty of friends that work as PAs that work an hour away from their supervising doc and work very independently in a satellite office. I have friends that work in urgent care by themselves and see patients by themselves. Working in the ER, I just worked with a team of whatever docs were on at the time. But the scope is wide, and it really just also depends on your comfortability as well. Starting out as a new PA, I was terrified and ran every single patient across my supervising doc because I just wanted to build that confidence. I wanted to make sure I was doing more good than harm, as you can imagine. But with time, with confidence, with all of that, as you could definitely work independently, we just do not open our own practice. So as a PA, you just cannot open like your own family medicine practice. That is what is, I would say that's what's restrictive in our capacity as being a PA.
Right. And an observation that I would make just to further clarify or confuse is that medical colleagues of all types are constantly talking across to their colleagues to clarify, to collaborate on behalf of the patient. It happens that in the instance of PAs in Delaware, there is a supervisory component added onto it. And as you say, the ability to open up your own independent practice is, at least in terms of current regulation, not possible. All right, let's see. Next question. Okay, I'm going to give this one to you too. If you take PA school and then you decide that you want to go further and become a physician, do you need to restart the process or can you continue from where you are?
That's a great question. Another question I also get asked a lot. There are bridge programs, they're called. There are not many, but there are bridge programs in which a certified physician assistant can go on and have a shorter duration and time in terms of like the didactic, the beginning portion, but still would have the same residency and all of that would still apply. So the answer is the journey would be slightly shorter, but not by much.
All righty. Let's see, we answered that question already. What are the programs I have to do in the summer of high school and in the future to become a psychiatrist?
I'll take that. So a psychiatrist is a physician. Psychiatry is a specialty of medicine. So if you recall what Dr. Levine was describing, during high school, start to focus in on some science classes, get your baseline, your foundation well set. Start to learn, to understand your love for science-based topics and make sure that it's there because you're going to need that, obviously, to proceed. Um, get a variety of extracurricular activities. And as we discussed earlier, some of them can be healthcare exposure, but service in any kind of setting is going to be important. Help you really recognize that you enjoy that you find fulfillment in caring for others, because you're going to, again, want that to sustain you for the rest of your career. And then the rest of the route is the same as we described. The ultimate choice to become a psychiatrist is the one you make as you are graduating out of medical school and applying for residencies. That's when you choose psychiatry, as do, let's say, like Dr. Levine chose emergency medicine, or I chose internal medicine.
All righty, question for you, Dr. Levine. Are there specific classes I should focus on to become an oncologist? And what we don't know with the person asking here is what grade are they in, but let's assume that they're in high school.
Yeah, it's really parallel to what Dr. Salam was saying, and I see similar questions in the question bank about what could you do now to prepare for a certain specialty. It's really not about the specialty, to be honest with you, and I will tell you, greater than 50 to 70% of people who think they're going to do one specialty in high school and college and early in med school will switch. So I probably would not focus on the one. But what's great is you have an interest in oncology. That's awesome. Now let's do something with it. You could volunteer in a cancer center. You could help with, do cancer research in college, or you can shadow oncologists. See if that really fits with you. If you have that passion, learn as much about it and do community things. There are plenty of community organizations that help cancer patients. That is awesome. If you can, really make a difference in someone's life while you're still trying to figure out what you want to do, colleges and medical schools will pick up on that. So don't totally focus exactly on the specialty unless you're having that passion or that nudge already. Just start exploring it and try and get into many areas of there as you can.
All righty. Boy, the questions are outstripping our ability to answer them. Well, okay. There's another question, extracurricular activities to become a robotic surgeon. In that instance, maybe if you're interested in engineering and in robotics, that could be something that it could be interesting to do in high school. So let's go ahead and dismiss that. Many people are taking a gap year or years before medical school. Is that helping when become a physician process is already long enough? What should we do to get into medical school right after completing our bachelor's?
Awesome. You and me.
Yeah, I'll start. You're right. There has been more of a trend um, of students choosing to take a gap year as they finish college, do a gap year, sometimes even two, and then go to medical school. You don't have to do that. If you'd rather not, and you did comment in your question, and you did point out the fact that the route, the training, education and training pathway is long enough as it is. That's a lot of years. It's not a necessity. What you really want to do is optimize your time as when you're in college, making sure you're getting the right classes, doing your best in them, as well as getting some good exposure through extracurricular activities, again, to leadership opportunities, service opportunities, research, if you'd like to do that. I'm just really presenting yourself as a well-rounded, dedicated person who's going to make the most of the opportunity in medical school.
I love that. I will say about 50% of people take a gap year, and about 50% of those people don't know why they're doing a gap year. So it doesn't help your application unless you are trying to do something, enhance your application through research or other stuff. You have a family issue, personal medical illnesses. You're not sure about medicine, that's fine. But just to do it for the sake of doing it, most deans are now saying it is not really a help. So you do not have to do it. And most people think, why push it off a year when you could really get started in your career a little bit earlier? So there's both sides of that coin, and there's no right or wrong. But Dr. Salam's right. It's all about elevating your passion and your career.
Ready? Switching gears a little bit. How is, if how is holistic medicine being introduced into medical schools, or is it not touched upon very much?
It is being introduced into the curriculum. I think more and more with each successive year. The proportion is probably still on the smaller side. You will be able to do more of a deeper dive into um, specialized areas of study in residency and definitely in fellowship. You're able to go deeper into subcategories of learning, including holistic medicine. The further along you get, medical school will probably be an introductory stage of learning on topics related to holistic medicine.
All righty. There are a couple of questions here that are asking about what can I do to do shadowing or volunteer work at Christiana Care, and how do I find research opportunities when I'm in high school? I'm going to group those all together. Over to you.
I'm going to defer to Tabassum a little bit because we are in the process right now of collating all the cool resources in the region to try and give everyone one place to look. And we're going to align with you guys at Delaware Health Force, Delaware Academy of Medicine, DHSA, all those groups and other hospitals are doing stuff individually. And I think that makes it confusing. And you'll see it in a lot of the questions. What could I do, or where can I get information? So just first of all, generally, shadowing for a PA, for nursing, for a physician, you can just Google Christiana Care job shadowing. It'll take you to any of those three. Tamekia handles all the nursing side. Liz handles all the PA side, and we have other people to help. So that's really cool. But if you're looking for research opportunities, you have to just sort of keep your eyes and ears open. Google is your friend. And I will say that, a lot of times opportunities come out from the state called IMBRI and others for research opportunities, but that's usually for college students. I'm going to give my own personal opinion. I'll see what Dr. Salam thinks. In high school, I don't think you should try and rush to try and get a ton of research or all these specific activities. Be a little more global, have some fun, try and find yourself, but don't get too in the weeds until college. Dr. Salam?
I certainly support that sentiment. It's sometimes not easy to get shadowing experiences under the age of 18.
Yeah.
There are requirements at different health systems, hospitals, or clinics. A lot of that is college is the era, the stage of your learning to get into that. Research, shadowing, training as an EMT, as a nurse, certified nursing assistant. That's when you're at the stage where you're able to get into active, hands-on clinical either jobs or volunteering. As a high schooler, introduce yourself to topics in science through your classes. Volunteer in the community. I really want to emphasize that. Help people. Practice that regardless of what you do. Just make sure you're cut out for a lifetime of service. That's what these careers are built around.
All righty, let's see, we're rolling down on time here, and we still have so many questions. Okay, there's a very specific question here. I'm graduating with a bachelor's in health science and am not pursuing more education at the moment. I'm currently looking at HR roles within hospitals, and I wanted to ask, are there any other healthcare career pathways you'd recommend that I might consider, especially ones where my degree, the bachelor's in health science, would be a good fit?
Oh, I'm a health science graduate.
Perfect.
Actually, yeah. I mean, health science is pretty broad. I'm not sure where this person took it. I graduated from UD. As far as my peers that graduated in health science, they are pretty wide range. There are some that went into HR, but I myself am in public health or in nonprofit like advocacy work and medical education. I have other friends who went on to medical school. It's on other people became, I don't know, like technologists at hospitals. Like it's really such a wide range of what you can do. Another friend of mine is a translator for like bilingual at I think actually at Christiana. So there's like not like a limit on that. I mean, I think that goes to say with a lot of majors, but I know health science is a very broad range, so it all depends on what you're actually interested in. And don't just go one way because you think you have to, is what I would say.
Okay. Just was answering a question here. So at least one of you said you went to the University of Pennsylvania, and the question is, any suggestions on how to stack the odds in your favor?
Good luck. That's what I'd say. Dr. Salam is the alum.
Just do what you do to prepare yourself for any college application. Nothing special or unique. It's been a few years since I went to the University of Pennsylvania. I think it's again, like if there's one thing everyone listening today is taking away, yes, you have to study hard, immerse yourself in as many experiences as you can, and present yourself as a well-rounded candidate at every stage, every application you make to every university, college, or program of study?
We're going to let this one be a last question because other people are typing in answers. So a question came in about if I do pre-med in undergraduate school, will I be able to focus my pre-med education?
I'll start
So,
there. Oh, yeah.
Yeah.
Tabassum, you go. Yeah.
Pre-med in your college years, undergrad years, is a synonym for a handful, like a collection of classes, prerequisites to allow you to apply to medical school. They usually are, Dr. Levine described them earlier, a couple of years of chemistry, usually general chemistry or inorganic chemistry and organic chemistry. 1 to 2 years of biology, general biology followed by genetics or biochemistry, some math classes, and usually one year of physics. It's not often a major. You can choose to major in anything in medical school, in college, and still apply to medical school. You can be a humanities major. You can be a psychology major. You can be an English major, as long as you also do that prerequisite set of classes in science. I hope that helps clarify that.
It does indeed. Alrighty, we are at time, everyone. Thank you to all of our presenters and to Dr. Salam and Dr. Levine and to Christy Handley and to Nicole Sabine for an excellent kickoff to the series. Next we're going to be following up on Tales from Emergency Medicine. Have a great evening, everybody. Good night.